Hi, I'm Jennifer Taniguchi, and I'm an orthopedic surgeon here at Glacial Ridge Health System, a center for surgical care. And I'd like to talk with you today about knee arthritis, specifically knee osteoarthritis. So this is a very common problem that I see in many age ranges, but typically I see it more in people who are 60 and older. And it is simply wear and tear on your knee joint that happens over time. It usually starts bothering you a little bit, and then it gets worse over time. Over years, usually. You'll feel an ache in your knee wherever the arthritis is the worst. So it could be on the inside of the knee, it's where I see it the most, or the outside part of the knee. Or oftentimes arthritis pain settles in the back of the knee, which is a common place to feel the pain at. It's worse in the morning when you get up after you've been sleeping at nighttime, and it can also be really hard to get up from, say, a chair to standing. And that's all due to the arthritis in the knee. It can cause you problems with walking far distances or going up or down stairs. You may also feel a clicking or grinding sensation in the knee, which can literally be the arthritis or the bone rubbing together. If you feel like you're having some of these symptoms, there are some things you can try on your own at home first. You could do rest, the usual ice, compression with an ACE wrap or a knee brace, and that can help decrease the pain in the knee. You could also avoid activities or try to that cause your knee to flare up a lot. And anti-inflammatory medications can help quite a bit, such as ibuprofen or aspirin, or Tylenol as needed. Also, topical muscle rubs can help as well, such as Biofreeze or Bengay, and just giving it some time to settle down. If you're having fairly severe pain or it's disabling or preventing you from sleeping, then I would say you should come in and get checked out, which I'd be happy to do. Typically, we'll start off with x-rays so I can see what's going on with your knee joint and with the bone. And with arthritis on x-ray, I'll typically see narrowing of the joint space and bone spurs as well. And I'll go over the x-rays with you. Then I also like to get a good history and talk with you more about what's going on with your knee, especially if you have a history of any injury. Sometimes that can trigger arthritis in the knee, or if you've had past surgeries, such as a meniscus surgery, that could also lead to arthritis in the knee. Also, interestingly, family history can contribute. So this is something I see in families, especially if you're on the younger side and you have knee arthritis. There's probably a genetic component to it. Then I also do a good physical examination, looking at your knee for any swelling, taking a feel for any spots of tenderness or pain, checking your motion, knee stability. And then we would talk about treatment options. Again, the same as before, I always recommend symptomatic care, like ice, heat, rest, anti-inflammatories, or Tylenol. Beyond that, what's really important is strengthening your knee or the quadriceps muscle. That seems to help almost any knee problem. You can either do that at home, and give you home exercises, or physical therapy can be really helpful as well. They can do some treatments to decrease the pain in your knee and also help you do the exercises to strengthen up your knee. If you try those things and you're still having a lot of knee pain, then the next step would typically be a cortisone injection. So that's where I place the needle into the knee and inject it with medication, which is cortisone, like a really strong ibuprofen, to decrease the inflammation pain in your knee. And that oftentimes helps a lot. And then that will allow you to strengthen your knee up so that you won't have arthritis pain any longer. Beyond that, there is another injection that's a gel injection, or it's also called visco supplementation. And in that case, they inject you with this gel that helps to cushion the knee from the inside. And it also helps to stimulate your knee to form its own natural gel or cushioning. And that's a natural substance, and that can last for a long time as well. Last resort treatment for very severe knee arthritis with disabling pain would be a total knee replacement. And that's a fairly major surgery that I only recommend if you've tried everything else and you're having severe pain and you feel ready for a major surgery with a tough recovery. That's where in the operating room, you make a large incision over the front of the knee, go past the muscle down to the arthritis, and replace that arthritic bone with new smooth metal components, and then plastic or polyethylene to act as the new cartilage. And that does work great to relieve pain, restore function, but you have to be ready to do the physical therapy and exercises to recover from that and to get your best function back. People typically do really well and are happy that they've had the surgery done.